The Virtual Curbside is a production of the Utah chapter of the American Academy of Pediatrics, the Utah AAP, working together to improve children's lives through education, advocacy, and networking. Hi, this is Paul Wirkus from the Utah AAP. Welcome to this week's edition of the Virtual Curbside, where we bring pediatric providers together with subspecialists to get smarter about all things pediatric and better acquainted as a community of caregivers. The Virtual Curbside is brought to you in part by a generous grant from Primary Children's Hospital. Primary Children's Hospital, the child first and always. Welcome back to the Virtual Curbside. This week is one of our book club episodes with Angelo Giardino, and I have to confess, I really look forward to, I don't have to confess, I should say, I really look forward to our conversations. Thanks for doing this, Angelo.
Well, thanks, Paul, for the invitation. I always look forward to our conversations.
And we're talking at the end of the summer, and you're just back from Canada, and I'm just going to Canada, and vacations are wonderful, aren't they?
Yes, they are. They are very energizing and restorative, I think is the word we're supposed to use.
I'm a little bit embarrassed to say that's exactly the word I was thinking of, that I think there's a sort of weird mind meld this morning.
Yeah, there you go.
So the other thing is that I've always found restorative, and I think you do too, is reading a good book. And so I think we both read a fairly short, good book for this month, and let's talk about it.
Yeah, please, let's go.
Things going well for you?
Yes, they are.
World of academics okay?
Yes, we are trying to deal with the headwinds we're experiencing, but staying focused. We in academics believe in teaching the next generation, pushing the limits of science and doing great care. And I think we're making progress on all three.
Those are all good things. The book, and I chose the book this month, Everything is Tuberculosis by John Green. We were just talking beforehand. I have read some of John Green's young adult fiction before. He's a fascinating character. He's a very, very good storyteller with a very interesting background. He really sort of broke through to the world with his book, The Fault in Our Stars, that I think did a couple of things for him. Number one, I think it increased the scope of his voice. And it also, I think, gave him a kind of financial security that allows him to do things. So, for instance, the topic of this book, surprisingly, Everything Tuberculosis, is about tuberculosis, among other things. But John Green, I think he has donated somewhere around, I think it's $1 million a year to tuberculosis, more than research, really tuberculosis care around the world. And this is a topic that means a lot to him. And this book, I think, really shows that. What did you think of the book, Angelo?
Well, I really liked it, Paul. I mean, I'm a little embarrassed because, I'm such a denizen of the developed world that I knew tuberculosis is still around and I knew that it's still a major public health issue globally. I don't think I understood all of the depth of issues related to it. So this book really reconfirmed, I guess, what I had learned over the years that tuberculosis is a really important infectious disease that we should pay attention to. And I just love his one quote: the cure is where the disease is not, and the disease is where the cure is not. And he really kind of walks us through that dichotomy that there's a lot of people in the developing world that are affected by tuberculosis, and we haven't really stepped up to control this scourge. And we should, because we know how to do it and we know the approaches to doing it. And we're leaving the developing world with a very antiquated way of screening, diagnosing, and then doing the initial treatment.
Yeah, it's interesting. He points out that tuberculosis has killed over 1 billion people in the last 2 centuries, that aside from the 3 years of the COVID outbreak, that it kills more people every year than any other disease. COVID displaced it for 3 years. And preceding that quote of his, the Ugandan physician said, where are the drugs? The drugs are where the disease is not. And where's the disease is where the drugs are not. Leading to the quote that you just shared, that the cure is where the disease is not, the disease is where the cure is not. And that's a matter really of, I think, both the way we see ourselves as a world community and, unfortunately, I think of human will in a lot of ways.
Yeah, and again, if you just want to be totally utilitarian, it is not a good idea. I mean, the little that I know about infectious disease, it's not a good idea to have this incubator of infection where resistance is likely to be developed, because eventually the resistance gets ahead of the interventions that we have, and then we're all at risk. So if you wanted to just be utilitarian, it would be a good idea to just contain this infectious disease and truly wipe it out. But he tries to elevate the conversation to the moral side of that. Like, if we have the ability to prevent suffering and misery, shouldn't that be one place where we put a little bit of our time and treasure? And I like that he kind of called us out on that. So I felt like I really learned something. He is a great writer, by the way.
Yeah, I was going to say, we're sort of making it sound like it's a position paper somehow, but it's a very engaging read.
Well, and particularly because a good writer, there's always a main character, right? So
Right.
there's this guy named Henry, who just so happens to have the same name as John Green's son, and he has a son named Henry. So he just kind of makes a lot of those connections, and he tells this wonderful story of Henry, who he met when he was an adolescent, and then follows his life course as well as the progression of TB because he has that diagnosis. And he really uses Henry as a great character to tell all the story about all of the shortcomings. And it's kind of you really start rooting for Henry. Like you
Do.
really want Henry to do okay.
Because it tells us the story of Henry over several years, and Henry's life makes several points that are important for us to know about tuberculosis. For instance, that his father took Henry off his TB
Right.
drugs when he was young, which probably led to him developing resistant strain,
Yeah.
and that then the various hurdles that come in tuberculosis treatment, and we have effective treatments for tuberculosis, but the way we institute those has, in some way, affected new hurdles. That, for instance, you have to be observed while you take the medications, but for some people, that means traveling 2 hours each way every day for a long period of time and setting your life aside to be able to do that. And I don't know that we think about the implications of good science sometimes.
Yeah, yeah, no. So he does a great job doing that. The other thing he does is he does connect the whole TB kind of effort to Partners in Health and Paul Farmer. So you always get a positive vote for me when you somehow get connected to them because they do really good stuff.
Right, absolutely. Now, you should also mention it's a fascinating read as well, putting tuberculosis in historical context. I didn't realize, for instance, that we owe tuberculosis to the existence of the Stetson hat, that the creator of the Stetson hat came west for rehabilitation and noticed that the hats that people wore were either smelly coonskin caps or ineffective straw hats. And so he invented the Stetson, and that was his last name. And that became our picture of the West. And also, we probably also at least partly owe the existence of New Mexico as one of the United States to tuberculosis because the people who went there for rehabilitation shifted the population in a way that made the state popular for accepting into the great United States.
And in addition, Pasadena was one of the places that TB
Pasadena,
went.
yep, yep.
And Adirondack chairs have something to do with
Yeah,
TB.
Adirondack chairs were at sanatoriums for people to be able to sit because you had to do as little as possible. Yeah, so Adirondack chairs of all
And
things.
even the start of World War One, because the three young people, revolutionaries that, essentially murdered Archduke Ferdinand, were so hopeless because they were dying of TB that they were willing to kind of go on a suicide mission. So it really does weave this thing that TB is about everything. But as we all learn in the book, the author, John Green, I think suffers from obsessive compulsive disorder. So you can kind of see how he's very focused on everything. And then he is somehow able to connect TB to everything and
Right.
you sort of get a little bit into his world, and that's why he sees everything connected. But it is like TB is really important.
It's fascinating too because when he talks about some of the features of TB, we've romanticized in the past even as being marks of beauty, the
Yeah,
pallor and the waifish thinness. And when he goes through the list of people who died of TB, all three of the Bronte sisters, for instance,
right,
and the
right.
Romantic poets. And then on the other hand, he also, I think, is quite effective in talking about the way that we stigmatize diseases. And there again, I think he has a toehold that understands that we stigmatize mental health sometimes, that it's a sign of weakness, it's a sign of
Mhm.
choice, and that the same thing with tuberculosis, that we have stigmatized it. And as he points out, it does sometimes sort into certain social strata, but that's not a weakness, that's availability of treatment and care.
Paul, I would say this book does a really good job at using tuberculosis as a vehicle to talk about all the different layers of a public health issue. And he does a good job at walking us through these in the different chapters. He also tells a story, so it's not a dry nonfiction textbook. He does tell the story of Henry and Henry's family, and I think that's really good. And then he does, I think, give us a little bit of hope in that he does kind of conclude the book with a call to action. And it does seem like at this time in our history, where I think there's real questions about global health and how much should our nation invest in that, I think he does a good job at putting the issues in focus. I mean, you might not agree with all of his political views, but he does make the case that in the developed world, we have a lot of resources that we could direct to the developing world and truly reduce human suffering. So I think as a physician, I really resonate with that because that seems to be a really good thing to do.
Yeah, can I share a quote from near the end of the book? James Watt, the inventor of the steam engine, his son died of tuberculosis. And so he says in 1804, there was nothing James Watt could do to save his son Gregory. In 1930, there was nothing my great grandfather Charles could do to save his son Stokes. But we no longer live in that world thanks to the accumulation and dissemination of knowledge about the illness and how to treat it. And so we have entered a strange era of human history. A preventable, curable infectious disease remains our deadliest. That's the world we are currently choosing. But we can choose a different world. In fact, we will choose a different world. The world will be different a generation from now. The question is whether we will look back in gratitude at the virtuous cycles or in horror at the vicious ones. And I think that's so important for us to reflect about that the choices we make individually, but more importantly, collectively, have consequences. And I hope to be able to think that way, to see our choices making a difference for other people.
Yeah, and I kind of feel like this book has really reawakened that interest of mine to see what are the top three, the top five global health issues that we should keep front and center. I think, as you know, our program does have a really good global health initiative, and I feel equipped to kind of ask the folks going to the low resource areas, what are we doing to contribute to the improvement of TB care? I'll also ask about malaria care
Right.
and infectious diarrhea. Like I kind of want to reconnect to that and in my own little way, ask the right questions and see what we can do.
Yeah. We were also talking beforehand. I think his fiction is very readable. Obviously, The Fault in Our Stars was readable enough that it became a massive bestseller and a very popular movie as well. So after I read that, then I read his book, Turtles All the Way Down. And I really didn't know much about him except that he was a writer before I read that. But he writes in that book about anxiety and OCD, both of which he experiences. And I think he writes very sympathetically that way. I think as a writer, I think he writes with a great deal of insight into other people's experience. And I think that was one of the things that really drew me into the book. But again, as you said, I'm quite embarrassed to not have known that I would know that tuberculosis is an issue, but
Yep.
that it's still the leading killer in the world, I did not realize.
Yeah, yeah. I guess the other thing too, just in terms of recommending the book, a lot of times who reviews the book suggests how good a book it is. So when I was preparing for this, Bill Gates wrote a review of this book.
Yeah,
So I
yeah.
think if this is on Bill Gates's book list, I think it might be one that we should take a minute because he's done a lot to try to help on the global health scene.
Yeah, yeah. And I think through reading the story of Henry, and you really root for Henry,
Oh,
um,
yeah,
yeah, I shouldn't spoil it by saying how it turns out,
yeah,
but
yeah,
Henry was in college at the end of the book, so that's a good sign.
yeah, yeah.
But personalizing it like that, I think that changes our view of the world generally, that being able to have a personal contact with something, it's much easier to shrug off abstractions than it is when we recognize that this affects actual people.
Yeah, well, to put a finer point on that last idea you had, I'm getting very convinced that my focus on quantitative data and, files and binders, I think stories are more important. Like, if you walk in with a binder and some tables and graphs, you might convince a person. If you walk in with a story, you might have the whole room behind you by the time you're done. So I think that's what he's shown us. Henry gets you really motivated to want to confront TB in the developing world.
Right, right. All right, so thumbs up.
Thumbs up, 2 thumbs up.
All
And
my
this is your
thumbs.
selection.
All of my thumbs are up on this one.
Yes.
That's a good thing. Well, I wish you all the best because I think the headwinds you're facing right now are real. And I think that navigating this is a really important thing because in medicine, I think we really want to make a difference.
Well, I feel very optimistic in this time in our history because we have a plan. We're going to keep taking care of children and we're going to be scientific about it and we're going to speak about it and we're going to show up every day and do what we can to take care of the kids that are in front of us.
Well, because like Henry, every kid's a biography. Every
Yep.
kid is a real life, and
Yep.
that's so important for us to foster.
Good. Well, thanks, Paul. Thanks for creating this opportunity to talk about this stuff.
All right, sir. We'll talk again in a couple of months. Thanks for joining us. We look forward to getting together again next time. The Virtual Curbside is available on iTunes or wherever you find your other favorite podcasts. Be sure to like us and subscribe. We want you to like us both because we're needy that way and because that will help other listeners like you find us. Check out our website, vcurb.com, for supporting materials, schedules, and other great stuff. The Virtual Curbside is an educational production of the Utah chapter of the American Academy of Pediatrics. The opinions expressed in this podcast, while carefully considered, are ultimately the opinions of the presenters and not necessarily of the American Academy of Pediatrics or our employers. And remember, the content of this podcast shouldn't be seen as a substitute for seeking actual personal medical care. If this is an emergency, hang up and dial 911. Otherwise, schedule a visit with a caring healthcare provider to try to get to the bottom of your concerns. None of this could happen without Elisa Stoddard, our extraordinary executive director of the Utah AAP. Many thanks to Tim Cosgrove for his help on the website and logo design. Thanks to Phil Wirkus, who composed the theme music. See you next time.